Now, when it comes to racial inequities in health, if we're not measuring it, then we can just pretend like it's not happening. So it is very strategic to say that we're not going to include these types of data anymore. We're not going to include sexual orientation or gender identity on these national research surveys that we send out every single year, where we've been including that data. We've had to have activism to get those questions added. Back in the 1990s, I believe it was, the federal government actually commissioned a report about racism in our healthcare systems. And in that report, it was unequivocally proven that race is the primary determining factor of people's outcomes in our healthcare systems. These are people who have access to care. This is not about not having health insurance. When you have access to care, race is the predominant predictor of your outcomes. And since we know that race is not genetic, right? And we have to say that because it's a belief that some people still hold, that the reason that we have these racial inequities is first because of some kind of genetic anomaly. Race is not genetic. So that means it's not race, it's racism that's actually creating these inequitable outcomes. I like to use one of our visionary lab members, Dr. Kamara Phyllis Jones, has an article that in a story that she uses to help explain racism that has been incredibly effective in helping people to understand how it operates. She talks about a gardener planting seeds in two different flower boxes. One flower box is old rocky soil, and another flower box is enriched, nurtured soil. And so she plants red seeds in one flower box and she plants pink seeds in the other flower box, and she plants the red seeds in the enriched flower box because that's her preference. She just likes red better. And so as those seeds start to grow, she starts to see that the red flowers are growing really strong, and that they are flourishing and that they're doing really well. And she sees that the pink seeds that she put into the rocky soil aren't doing so well. And even the strongest pink seeds are only growing up to a certain height. And so she talks about racism in three different ways to think about racism as showing up in those flower boxes. So the separation, the initial separation of the flowers into two separate boxes with two different types of soil represents what we think about as institutional racism, right? Communities were actually physically separated and given different types of access to resources historically. And that's true in our hospital systems. There were times where black people could not go to white hospitals where they had the resources and the technology that they needed for survival. And then she talks about personally mediated racism. So, if a bloom from a pink flower blows over into the red flower box, and the red flowers are kind of like, get out of the box. This is our box, not your box. And that's what a lot of people think about of races as racism. Those personally mediated interpersonal interactions, and we see that in healthcare.